There you go.
Okay, thank you. I'm going to share my screen here. Do you see this?
Yes, we do.
Do you see this full thing here?
Yes, it's great. We see it.
Okay. All right. Thank you. Thank you, Emily, for inviting me to this group. I did not know this group before, but I feel okay. It's very interesting work you're doing, and also I feel after reading the descriptions, I feel okay. This is something I'm also interested. So hope we have more connections in the future. So here I'm going to talk about green space and the health outcomes I focus mostly in the past, which is pregnancy outcomes. And I'm also interested in children's health and elderly health, but in most of my green space related publications, it's about pregnancy outcomes. Here I live in Irvine. I don't know how many of you have been in Irvine before. None? Yes? Okay. Okay. Yeah. Okay. So Irvine is one of the greenest city. Actually, it's ranked #1, the greenest city in California and the 4th in the United States. So I feel I'm so fortunate to live in Irvine, but it's not the case for our other locations, like our neighboring county or city in Los Angeles. You would say there are a lot of news media asking for more green space for the neighborhoods, residents, and in addition to the amount or the mass of green space, they also said a lot of people do not have good access to the parks, to the green space. So here, definitely there is this discrepancy. There's like the differences in people based on location, people's exposure to green space. But I'm mainly going to focus on the health outcomes of green space due to the limited space here in time. So here I'm outlining the major points I'm going to make. One is a short background, then discussion of the green space and pregnancy outcomes. That is the main thing I'm going to talk about, a little bit about access to urban green space, and also a bit about my reflection about the current work I've done, and then the future research directions in the space of public health. Just background, I think all of you here may be more familiar with the green space, and then there is like different definitions of green space based on the fields and discipline. And if you look into the literature, there are like many different definitions, as I show some examples here. And people just interpret green space differently. And here, this is US EPA's definition of green space. Basically, it said green space is land, not building, and it's a land that's covered by greenery and not like blue space, like water bodies and other things. So like in our work, we mostly used something similar as the EPA's definition. So I like this figure because it shows the potential pathways of green space impact on health. I just want to spend a little bit of time of explaining those pathways and like what the current research stands. So this paper came out in 2017, so it's a little bit outdated, but still I like this framework explain the pathways of green space. The top ones are the main potential impact of green space. Basically, it said that green space can help restoration and help with stress reduction. So for this type of pathway here, there is consistent and promising research ongoing. And a lot of those show that green space can promote recovery from stress or replenish directed attention fatigue. And then the other one is social contact. This is also very promising pathway, but it's relatively, few study that has been linked to this pathway. But, just by thinking of how you interact with your neighborhood and how, for instance, during the weekend day, you would walk dogs, you would jog or walk around the neighborhood. Do you prefer to choose the routes that has a lot of greenery? And basically this pathway says that the green space would encourage outdoor leisure activities and your social interactions with your neighbors that promote the sense of belonging to the community. So basically increase this social contact that promote better mood, better relationship, and help with health promotion. And then I am an environmental health researcher. So for my research, I do more of the middle ones of the pathways. So for my PhD training, I started with air pollution and exposure assessment and health impacts. So I published a lot of work on air pollution impact. So I started also, when I look at green space, trying to think about pathways, whether green space can reduce air pollution. For instance, the vegetation can absorb or filter the air pollution. Also, in places where you have a lot of vegetation, then likely you don't have many sources of air pollution emitters, right? So it's just competing mechanism of emission sources. And also, we're talking about the heat. And that's happening now. And with the greenery, it can reduce the temperature, air temperature, and also land surface temperature. So I'm very interested in this. And even though you can, tell me that the impact of green space on those effects could be very small. That's true, likely at the individual level. But if you think about the population level, and the impact can be substantial. And then the other thing I'm interested in is physical activity. As someone working in public health field for a long time, I'm interested to see how green space can increase physical activity levels. And for this research, there are a lot of studies that have been published, but there's no firm consensus has been reached. The main thing is that how people measure green space differs substantially. So as I showed you the definition of green space in the earlier slide, people look at green space at a residence, look at green space at the neighborhood level, or just distance to the parks, and many other measures. So there's a lot of heterogeneity in this space that can be improved in the future. And then there are also bottom ones, less explored hypotheses or pathways, although they are also very promising. One is biodiversity hypothesis. Basically, this says that the more of the green space exposure can increase the diversity of microbiota. And there was a few published study looking at this. And then there's one study in Finland that linked children's microbiota exposure on the forearms of the children and their residential land use types of green space exposure. So there's some increase in studies on this area. And then there's also, last one is the biogenics hypothesis. This one basically says that the greenery vegetation can emit a mixture of compounds such as volatile organic compounds. And these compounds after you inhale that, these compounds can have biological functions in the human disease pathways. For instance, it can inhibit the activities of interconnected cell signaling systems. And if there's no inhibition, if there's overactivation of some of these pathways, and this can lead to pathological processes that resulting in cancer, diabetes, inflammation, etc. So this is a very interesting pathway, but very little has been explored. So this is basically the mechanism I'm interested, but for today's talk on green space and pregnancy outcomes, I'm mainly going to look at the main association as well as the potential pathways of environmental exposures and physical activities. So for my research, I'm going to first, talk about green space and low birth weight. So this study was published in 2019, and we used the birth certificate data from California, the entire state of California, with over 3 million records. And then we have residential addresses of all these detailed at street level residential addresses from the birth certificates from 2001 to 2008. And then there are, we have also got the green space exposure, which is called NDVI, the normalized difference vegetation index, which is a remote sensing-based measure of green space up from very top. And then I'm just going to quickly show you the results. And basically overall, we found that residential green space is associated with lower risk of terminal birth weight. And then here, this shows you urban versus rural areas of green space. And basically we found the association mostly in urban areas, not in rural areas. And then we also looked at the income and then education. Basically, the exposure effects we observed is somewhat higher in the more marginalized or disadvantaged populations, such as here, at a very low income group and at very low education group. So you can stop me anytime if you have any questions. Okay, so, and then we also looked at the potential role of air pollution in mediating the effects, meaning that whether the beneficial effect we observed between green space and low birth weight is through reduction of air pollution. So we looked at fine particulate matter, total mass, as well as some elements of fine particulate matter. And then we basically, these are different numbers, but basically overall we observed around 10%-ish of mediation effect, meaning yes, the beneficial association of green space and low birth weight is partially mediated by air pollution. And then in the second study, we looked at green space and preterm birth. Again, we used the birth certificate data in the entire California state. And then we also used NDVI as a measure of greenery. And we looked at preterm births less than 37 weeks, moderate preterm births less than 35 weeks, and very preterm births less than 30 weeks. And again, we observed, so here is a line of 1, risk of 1, and then you can see all of those are below 1, meaning beneficial association. So we basically observed the beneficial association for all of those outcomes, and then somewhat even stronger association for the very preterm birth category. And there are also some slight differences, also not statistically significant, like the buffer size, because we're interested to see, how the green space have an impact of it, whether it's like just the green space like right in your yard or very close to your home, or these are in the neighborhood. Basically, we observed even somewhat stronger association in the larger size buffer, like here 2,000 meters, that's more like a neighborhood level green space. And then for the pregnant women, we also looked at like which time window is the most sensitive. So this is gestational months, and like all of those gestational months are significant, but we say like you see a dip here. So this is like in the middle pregnancy, some, especially like for the 2-kilometer buffer, there's a slightly like even stronger. So we think this is expected because we think pregnant women who are in their second trimester may be like more willing or more capable or like whatever, because of their health status, they do not have morning weakness, so they're not too heavy in the body, so they may likely like use the green space more than the early pregnancy or the late pregnancy period. So you see somewhat stronger association in the second trimester. And then this is a busy table. We looked at interaction of air pollution and green space. So you don't need to look at those like detailed numbers, but basically we looked at additive scale and the multiplicative scale interactions, basically to say, because air pollution has adverse impact. Lack of green space has adverse impact. So if you look at both factors together, are they going to have even stronger synergistic effect than each individual factor alone? So we looked at the additive scale, which is saying that if we observe greater than 0 numbers here, then the 2 exposures combined would have larger effect than summing individual factors together. And then we also looked at the multiplicative interaction. This means if this number is greater than 1, then the combined effect of the 2 factors is larger than the product of the individual effect factors. So basically for the most of the categories, we did observe what we expect. So meaning that there's potential positive interactions between green space and air pollution. Lack of green space, or higher air pollution would lead to stronger adverse impact for the pregnant women in terms of preterm birth. So this is a paper you're mostly interested, and this is about green space, postpartum depression, and physical activity. And for this paper, we used the data, electronic medical health record data from Southern California Kaiser Permanente. So we use this data instead of the birth outcomes is because birth certificate data is that birth certificate data do not have good records for pregnancy complications. And in California, there's no birth records that have postpartum depression data. So basically, we have to get the data from the electronic medical records through our collaborators in Kaiser. And the other thing thing is that the outcome data, the postpartum depression data, is better recorded in the electronic medical records of Kaiser system than many other places. We will, this is like the main, like a research question we want to ask. Basically, our main exposure is screen space, outcome is maternal postpartum depression. And then, of course, there are always confounding factors we want to control for. And then we want to look at whether physical activity mediate the association between green space and depression. So, this is our exposure measures, and this is quite complex because like in the previous two studies I mentioned for terminal birth rate and preterm birth, we used the remote sensing based NDVI. And here we are using multiple exposure metrics. Why do we want to measure multiple indicators of green space? This is because for the NDVI, it's like satellite based and it's seen up above, right? So it's more like a bird eye view from the space. While for our human beings, when we walk around and we see from our eyes, right? So like the NDVI is up vertical angle. And then for our human eyes, we see the horizontal angle, right? So, and we see the green space at our eye level, and then which is different from the upward, downward level of green space. So we think that the eye level green space is also important, even though we don't know which one is more important, but we think for the pregnant women who see the eye level green space, that may help them to determine like where to go and the activities. So for the eye level green space, we used the street view based maps, as you can see on the top panel here. And we developed machine learning models. Of course, there are a lot of coding, annotation of the images, like the bottom panel. And then we also developed, like we coded over 1,500 or more of the images by category of trees, low-lying vegetations, and grass. And we developed a machine learning model and validated that to predict the different types of greens based on the street view images. And then we apply that to all the streets in Southern California. Every 200 meters apart, we would have a point of measure. And these measures are from 4 directions. So then you would capture like street level green space by type. And then, of course, we also used some of the traditional way of green space characterization, NDVI, and land cover based green space, tree canopy cover. These are from the USGS. And also a lot of studies looked at proximity to parks. That's what we also included. And we also look at different buffers. So before I go to the results, I also want to highlight the outcome measure of postpartum depression. So it's it's a bit hard to measure depression. So I don't know whether any of you do mental health research, but there's a lot of misclassification. And like in Kaiser's system, they use the Edinburgh survey to do this survey for depression, and they do this multiple times at women's well child visits, and very frequent in the very early like the first few months after delivery. And also there's follow-up of physicians after, if they get the Edinburgh score greater than 10, and there's a follow-up multiple times. And also for the postpartum depression outcome, we used not only the ICD code, but also the medication to that, so that you can combine the two to make a better identification of the outcome. Okay, so then this is our main results about different types of green space and postpartum depression. Again, here is the line of 1. And then if the risk is lower than 1, that means beneficial association, greater than 1 means higher risk. And the confidence intervals, if all of those is on one side, that means statistically significant results. So basically for these main results, we say that street view based green space for the total green space and tree green space, those has beneficial associations with outcome. While very interesting in the grass, you see somewhat higher risk, even not significant. And then for the NDVI based green space and non-cover green space, they show somewhat higher risk. And then, but for the tree canopy based green space, you see the consistency with the street view based green space with more of a beneficial association. So basically we say that green space, particularly tree canopy, tree coverage has beneficial association with reduced postpartum depression risk.
June, can I
Okay.
interrupt with a question? Just
Yeah.
since we're a relatively small group. I think you had said when you were pulling information out of the electronic medical records for this, that you also had information on if the pregnant women, well, not the postpartum women had also been taking some kind of antidepressant.
Mm-hmm.
Did you control for that at all in the models?
So we don't. I think we only got that into our model to get the outcome.
So you do account for it, and I mean you don't, but you don't account for it in the model at all?
So not in this model,
Okay.
but in the model where we develop our outcome. So for our outcome identification, we have the ICD code and we have the use of medication.
Okay.
So,
and so it's the use of medication that that you use as kind of a proxy for telling you that they probably were diagnosed with postpartum depression.
Yes, yeah.
Okay, I was just thinking about how, how that could potentially, be confounding or influence mood in general, because it's also a treatment, and we're talking about green space also helping to alleviate postpartum depression. Have you given any thought to that?
That's a good question. I don't think I've thought about that, whether we can separately get data for the medicine use, right? And see how that, maybe to look at separately, the group with no medication use, the group with use, and see how the results may differ, right? Yeah.
I mean, you've got fantastic data, and this is really interesting. I just think that might also be, another kind of interesting research question to look at.
Yeah. Okay. Definitely. Thank you for the question. And I can ask my colleagues at Kaiser to see whether they can provide us the more detailed data on the subcategories. Thank you. Okay, so this is our results looking at the physical activity part. So because our assumption is that green space have the association with postpartum depression and partly through the physical activity pathway. And you can see here first, this is the association between green space and physical activity. And like you can see, there is like positive association of green space and physical activity for total green space and trees, but not for the grass, right? So I think this is mainly, I think, because grassy area is more for like other sports, like children's sports activities, and also the more of a grassy area, likely the less of the tree coverage would be. So they're competing in space. And these grassy areas may also like not a lot of area that pregnant women or postpartum pregnant women would use much. So I think this is why we think it's like negatively associated with physical activity.
Does
But
the total green space include the measure of grass though?
yeah, the total green space include the measure, but you can see there's, compared to trees, there's like somewhat smaller association.
Well, I don't know about, I think I'd spend some time asking pregnant women about what areas they use before thinking about that, because I could see picnics and family gatherings happening on the grassy areas. But maybe the shade is more important or the trees are more important. So it's hard to
Yeah, yeah. Oh, I also want to mention that this, for the physical activity data, we don't have postpartum physical activities. So here, the physical activity data are the activities during the pregnancy. So we have asked like 3 trimesters, their physical activity levels. Yeah, I don't know, maybe after delivery or when the kids are, you know, a bit older, that they would use the grass areas more than when they are pregnant.
I don't know.
Okay, so this is what our data showed us. And then this is the mediation effects. Basically, we say a small mediation effect by trees. So you can see for the total green space, it's not significant, but for the trees, it's about 5 to 6% of mediation by physical activity.
And this is using your machine learning definition of green space. Is that
this one is machine learning green space top one, the straight view, and then this one is from USGS tree canopy, and this one, the tree canopy, I think is from the images from the top, and this one is this yeah, straight view.
Interesting, yeah.
So it's basically, well, so it's, I mean, it's showing you that you've got consistency then in your machine learning measure. And then in the tree canopy of 500 meters, that's from USGS,
yeah,
from USGS. So yeah, I mean, it's you, I don't know if you'd have any statistically significant difference between 5.5% mediation and 6.2% mediation. Those look pretty close. So it probably validates the machine learning measure. Yeah, if you're comparing those two measures as well, which I think, Jeanette, you had a question about validation too. So
yeah, I was wondering how you mentioned you validated it, and I just was curious how you did that. It's very curious.
Yeah. So thank you. So we asked a group of students to annotate images. And then in terms of validation, we just use a set of unused images, annotated images for validation. So, and there are some differences. I would say like for the street view, you do have the horizontal view, but here, because we get the points from the street, So you mainly capture the greenery like in public areas outside your homes. You don't have like the green space in your backyard or in areas where you do not have access to.
Right,
So,
the whole thing is street view. So the camera's on the street, so there's street in every
yeah.
picture. Yeah, so it's
Yeah.
not never going to be completely green. Right, exactly.
Yeah, well, for the tree canopy cover, you say from the top, so you cover every single space.
Yeah.
Okay, so any other question on this slide? No, okay. So there are some strengths and limitations of the study. So we used a large and diverse population in Southern California. Kaiser system covered about 18% of the total population in Southern California. And we have high quality clinical data. And we also use different types of street view based green space. And we also have good measure of physical activity. And then the limitations is that for the street view based green space, we only did like a snapshot of the image. It's not continuous. Therefore, we don't have the temporal variation of green space. And also we don't have people's perception on the quality and their access, their use of green space. And there always could be potential confounders. And we don't have the physical activity in the postpartum period. Okay, so then I want to talk another study we did, which is more of a lab setting. And this study looked at the more of a virtual reality green space and the short-term impact on pregnant women's physiological and affective responses. So basically, the PhD student who did the other work, she thought that not everybody can have access to green space. Especially those live in poor neighborhood, marginalized communities, and also for pregnant women who are in the very early stage or late stage, or they have some conditions or complications that may make them stay inside, so they cannot have access to green space. That's why the question is whether we can create the virtual reality greenery environment and see whether that can have a positive impact to these women. So this was done back in COVID time, and she was successful in recruiting about 60 healthy pregnant women in early pregnancy in their first trimester. And then she recorded different types of, mainly 3 types of space in video, 5-minute video. So the top one is top high green space exposure. This is middle moderate level of green space exposure, and this is low or little, nothing basically green space exposure. So and then these are randomly assigned to 3 groups, high, middle, or low exposures. So this is a setting. She's a student who did the experiment. This is a VR machine, and the pregnant women would be equipped with this and to watch the videos. And this is the timeline of experimental procedures. It's kind of complicated, but basically pregnant come in and rest for some time and doing baseline measurements, and then use this TSST social stress test. Basically assign some tasks to these women so that you can increase their stress levels in a relatively short time period. And then you increase their stress level, and then you conduct the measurement about their stress. And then then have them watch the video, and then test again for those stress-related indicators, and then rest, and then we take, you know, some saliva samples, like here. Yeah, so basically those blood pressure, heart rate, and then we take some blood saliva samples that would take a bit longer in this period, rest period. So so these are the before and after. This left side points are the baseline, and then the middle sets of points are after the stress is raised, and then this right side points are this after they watched the video, different 3 groups, and then basically you do see the change, right? I think we are, you know, confident that we see the positive or increased stress after their task, and then we also see the drop in this stress after they watch the video, although at different levels. So there is no significance test here, but here is, you know, the panel after we've done statistically significant test. Basically, we only observed 2 positive statistically significant results. By comparing the group of higher green space exposures with a group with no green space exposure. So the references group is the one who watched the video with no green space. And then we see statistically significance results of reduced blood pressure here. And also here is the reduced saliva alpha amylase level, which is acute indicator of the stress. And this is their physiological responses. And then we also looked at their affective responses. And for those affective responses, there are many questions, like a positive effect, a negative effect. We've grouped them by factor analysis, and like for the positive affective skills, we mainly found 2 main factors, and this can be categorized as happiness and attention. And those are in the right direction of our expected impact. Basically, more of a green space exposure would increase the happiness and attention. And for the negative affect skills, we found 3 main factors. And those are anxiety and anger and shame. So, and basically we found that the group with less green space exposure, and they would have like more of anxiety, anger, and shame. So, again, so those are the statistical significance test. And for this study, there also strengths is that we used the I guess it's relatively new when we published the study, the virtual reality video to test the acute association of green space exposure and this physiological and affective outcomes. And we also did the biomarker measures. And this is a double blending and randomized design. And then limitations is that by using the virtual reality, you don't have the real feel of green space associated with like the smell and the sound of the natural environment, like birds. And you know, it's hard to have this immerse experience in a real natural environment. However, you can just say, you can tease out some of the potential confounding factors. You can say we just focus on the virtual environment, and then maybe how people see the greenery would have a positive impact for their health outcomes. And also this is short term, so likely it's interesting to see how this can turn into any long-term impacts. So, and then who have access to green space, I would just make it very brief. And then this is the machine learning study we published that I mentioned earlier, and then use that data. We looked at green space exposure in LA, and then like basically we just found all of those negative associations, meaning the population who are less educated, who are less, I think, socially, economically disadvantaged, that they have lower green space exposure. So, and then here is the public health implication, and also what I think are the future research directions. Basically, more and more research has shown that green space has been associated with a wide range of public health benefits. And compared to air pollution and many other environmental hazards, green space is one of the most modifiable risk factors. So it's relatively easy to change. And also considering the changing climate, the extreme heat, and then flooding, green space definitely can have co-benefits of not only reduce pollution, reduce heat, reduce noise, and can also promote physical activity and likely more richer microbiota and all of those other pathways we have talked about. And green space is disproportionately distributed in space so that the lower socioeconomic groups and people of color may have less exposure to green space. That also means that we can, do more. So that means opportunities for us to do like plant trees and to do more actions in these neighborhoods so that can have mutual benefits in like fighting climate change and promoting public health. And then in terms of the research design, I think we need to have more longitudinal studies rather than the cross-sectional studies, and definitely better exposure assessment. So in addition to just like the type and quality of green space, access or perception of green space, we can also like look at like morphology of the green space and like connections and like in terms of the planning, urban planning perspective, architecture, designing of the neighborhood, so we can have a more cohesive understanding of the type of green space and the use pattern of green space. I would want to see like more studies looking at the mechanisms, especially the less studied mechanisms, such as the microbiota and also the chemical emissions from the green space. And also exposure and cell level pathways. And I think both quantitative and qualitative studies are needed to help answer the questions on how much, where, when, and what types of green space is needed. So I mainly focused on the quantitative studies, but I think even for my own research, I would want to do more of a qualitative or mixed methods studies to better understand the community needs and help to make a change in the communities. I'll stop here.
Thank you so much. I don't know if we have time for questions, but we appreciate this talk so much, and it was so interesting.
So much data. Yes, it was really interesting to
Yes,
see all this. Very
Yeah,
great.
thank you. This was fantastic.
I'm
Thank you.
encouraged that you say that green space is easy to change. Like, oh,
Relatively, sorry. You
great.
mean-
I'd like to see more green space. Let's tell everyone it's relatively easy. No, it's great. Yeah, I think if we could think of it that way, that'd be good.
Yeah, and also I want to mention that one of my colleagues in here, UCI Air UCI unit, doing like atmospheric chemistry, and she's looking at different types of green space and the emissions of chemicals, and not all the trees would emit all the beneficial stuff to the air. So sometimes the trees may emit certain chemicals that may lead to higher ozone pollution and even higher fine particulate matter pollution.
Really?
Yeah. So
I have no idea.
Yeah. So one of her
yeah.
research area is to see like what trees you need to plant. It depends on which area you are in. So I think I did not talk about that, but I think it's something we need to bear in mind. Not all trees are equal.
Wow. Okay, I didn't know that. That's
Very
great.
interesting. And Dr. Wu, I'll also send you the link so that you can stay involved with our group. We have other work groups as well. We have a monthly town hall meeting. So we'd love to get you involved in the PAPREN network.
Okay. Thank you.
Definitely. Thank you
Yes,
so
thank
much.
Thank you so much.
Okay. Thank you. Bye.
Bye.
Bye. All right, I know we're almost at time. I just wanted to remind everyone that our next meeting will be July 29th. We'll be joined by Dr. Nashira Brown of the University of Alabama at Birmingham, and she is going to discuss her paper assessing the built environment programs and policies that support physical activity opportunities in the rural Deep South. I'm really excited about this presentation because I know I've focused a little bit more so on more urban green space in these monthly presentations. So I'm excited to talk a little bit more about rural physical activity and the built environment. I put in the...
Oh, Emily, while we're talking about our next meeting, I want to propose that maybe we think about moving Dr. Brown's talk to August and maybe taking July off, just because we might have pretty low numbers with people being able to attend with summer vacations. And I don't know if others have thoughts on that, or
I was wondering when our time off was going to be, but yeah.
Yeah, I wasn't sure which was better, like July or August, if August is a more heavy vacation time, or...
Well, August is busy if people teach, trying to get the semester together. So I don't know, that's a good point.
Oh, okay, got it.
We also might want to co-promote this with a rural group. Rural
Okay.
physical activity group.
definitely.
Robbie, August is busier for you, so you prefer having July and taking August off? I don't know. What do those on the call, the others on the call think?
Well, I don't know. I'll be gone, so I won't be able to make it.
Okay.
So
I think that's when the rural group is taking their time off is July. So I mean that could work to promote it through them because they don't have a call themselves that month. I think they're taking July off.
Okay.
But
I
either
mean,
one is
I can
fine
always
with
set
me.
out a doodle. I can send out a doodle poll and see what everyone's preference is. But we definitely want to have something either July or August, correct? We don't want to just kind of skip both months and pick it up in September. I'm
no,
just...
I think we would want to do one or the other.
Okay, got it.
Yeah,
all right, I can send out a doodle poll.
And your speaker is already set, it seems, so that's
Yes,
in favor of
she is
keeping her.
available. I mean, there's still a month, so I can reach back out to her and see what end of August is looking like for her. That's better.
I don't know. We just lost Corey and Brett, so yeah. Well, yeah, we need to, I think about a different time because this is also a low attendance. I know